super excited to have Dr. Jeffery Gerhardt here. He's the mastermind behind this Ortho Training Institute, right? So here's the thing, guys. I want to ask you a couple of questions here. Number one, do you do ortho in your practice? Number two, do you do comprehensive ortho? And I'm going to throw a third one here. Number three, do you actually know how much you refer out? Well, the reason why I'm asking those three questions, the reason why we have Jeff here today, because Jeffery is the man behind Orthodontic Training Institute. So Jeff, welcome to the show. Welcome to the group. We have a whole bunch of people just excited, ready to hear about what you're talking about.
Oh, well, thanks for having me.
So, I'm going to just jump right into it. Because again, we hear all the time, from specialists and whatnot, like, oh, GPs, you got to stay in your lane, right? We hear about that when it comes to implants. We hear about that when it comes to like taking out wisdom teeth. And we hear it when we talk about ortho there. And I want to ask you, talk about your background, talk about, your training, and why are you so passionate about helping GPs add ortho into their business?
Okay, first of all, I think, I graduated from dental school from San Antonio in 92. Then I started my ortho career from 96 to 98, taking a 2-year course in Dallas. And then I've been an orthodontic instructor for the last 20 years.
Wow.
I think ortho is a really fun way to practice, and it's not that hard. Like example, when you're in dental school, it's fine, but they don't really teach much ortho. But it's hard to at a graduate level because it takes a little while to learn it. I mean, you're learning how to do fillings, this and that, and so forth. But I mean, when I was in dental school, they taught you how to do a model. They taught you how to do, Ceph analysis. Why would you do a Ceph analysis? And they made it really complicated. But I think ortho is a lot of fun, and so I'm trying to spread this to other people. And it's something other people can use a lot. And so what I did was I was teaching for 20 years for Orthodontic Institute for the Academy of GP Orthodontics, and it's a good group, but the only problem is they didn't want to modernize.
Yeah,
they don't want to use new techniques and new bracket systems and so forth. But nowadays, it's much easier. It's just like endo. Remember when you use K files and so forth? Well, now we're using other things to do endo, and it makes it a lot easier, like Wave 1 and so forth. Same with ortho. And as a general dentist, it's hard to get a good education in ortho. So what happens is it's just like anything else. I think you need to learn hands-on. So like when you were in dental school and you learned how to do a filling, they didn't just show you a picture of a filling and say, hey, here's a picture of a filling. Go do a couple, have some fun with it. They said, hey, here's a filling. Let's practice on a model. Let's have somebody watch you practice on a model. Okay, well, now let's work on patients. And we'll help you because we're going to oversee you working on patients. Well, this is the same thing. It's a 20-month hands-on course. You meet every other month and so forth. And you have a lecture, we work a little bit on models, but not that much. And then you see patients. And so to me, ortho is all about treatment planning and troubleshooting. You have to know how to treatment plan it like that, which isn't that bad, but you have to know how to do it. And troubleshooting, like example, when you're doing an ortho case, they have most manufacturers, whatever bracket system you want to use, has a sequence of wires you use. You go A, B, C. They try to make it cookie cutter, but it's not so much. You have to, every time you see the patient, you have to make assessments of it. Okay, let's say my bite's not opening. Well, I'm using technique A. Well, let's go to technique B and sometimes technique C. But you don't learn that unless you're working on a patient. So I was kind of disappointed with some of the ortho classes for general dentists and pediatric dentists and so forth. And so we decided to do a 20-month ortho class using self-ligating brackets. The only reason we use there's pros and cons to all bracket systems, but the self-ligating brackets just a little easier to use. Well, look at it this way. This is what most orthodontic specialists are using. So why would you? They're the ones that go and study it for 2 to 3 years. So why would you think about using something else?
Yeah.
The mechanics are easy. The prices come way down on it. For me, because the mechanics are easy, it's much easier for me to teach. Not so much wire bending and so forth. But on the other hand, it's cutting 3 to 4 months off a case. Mechanics are easy or easier. You don't have to see the patient every 2 months. I still like to see them once a month because I That's just me. I like to really watch stuff and so forth. But I think it's really good. I think it's really good for a dentist to learn. Like I'm in touch with a couple of dental schools, and one problem is they don't teach much ortho in dental schools.
Yeah, no, they don't.
No, and so like I went to a couple classes, and that makes dentists think, oh, it's really hard,
Yeah.
or maybe it's an airway. Like I used to have to teach that ortho doesn't affect TMD because it really doesn't, and dental dentists are scared of doing it because they in dental school we were taught, oh, you're going to miss a job. And now it's the airway thing. You're going to mess your airway up, which doesn't have much effect on ortho anyway. But that's just a good way of learning things. And most dentists that complete our course are doing orthodontic courses. A lot of them have converted to just ortho. But then on the other hand, I mean, there's some cases I don't want to do. I want to send to a specialist, just like there's some root canals I don't want to do.
Yeah.
There's some extractions I don't want to do, and I want to send them to a specialist. And those are, I mean, ortho, it's mainly orthodontic case. So I know how to do them, but I don't feel comfortable doing them. But molar class ones are easy. Molar class one extraction cases are easy. Mild class twos are easy. Full step class twos is a little harder. Full step class threes are a little tougher, and so forth.
So Jeffrey, I got, as you can probably imagine, I have a whole bunch of questions that just got sent to me. So guys, just to let you know, you can type it in the comment section. I'll be looking in the comment section, but if you want to be anonymous, message to me on Facebook. I have my messenger open, and I have a whole bunch of questions. So Jeff, you ready to dive into these questions?
So somebody's listening? That's cool. Okay.
So here's the thing. The first question is that what's the percent of cases could someone expect to do after taking the course? So I guess what they're trying to ask is like, out of like, 50%, 60% of the cases that kind of walk through, what's the percent? This doc wants to know.
Good question. 80% of what you do in ortho is open bite, straighten teeth. That's very simple. That's just, they have an overbite, class on molar, or level on line. That's about 80% of what you do. So you can probably, after this course, you can probably do about 90% of what walks in the door.
Wow.
It depends on yourself. I don't know what your skill level is. I mean, you got to read a couple of textbooks, and I provide those to you, and so forth. But you can do, extractions now it used to be about 20% of the market. Extractions were. Now we're down to less than 10%. And don't be scared of extraction cases; they're not that bad.
Yeah,
and so forth. Does that help at all?
Yeah, no, that's great. Now, there's another question here is that you had said this is a hands-on, and again, it's super important that it's hands-on. You can only do so much on a model, right? You got to work on patients. These patients, this doc wants to know, are these patients, can we bring our own patients? Are these patients that the Institute provides, or is this patients that we bring ourselves?
No, we provide everything. It's hard for you to, we're in Austin, so one, you have to come into town. And so before a class, we screen patients all year round. So basically, I say, look, I can do your case, not a problem, with exceptions a couple of cases that are really difficult I might want to do. But I just say, okay, I can do your case, or you can be in an ortho class for half price, pretty much.
Wow.
And so before you get here, we have all the patients ready to go. They're treatment planned, they're restored, they're healthy. If they have gum disease, we treat that. And extractions, they're all done already. And then everything's treatment planned for you. And so then in their charts, I write a little scenario of here's how you do the case: step 1, step 2, step 3. So this has something to follow. But then when you're in a clinic, what happens is every time you see a case, an instructor comes in, talks to you about the case, what to do, even though you have an outline to follow. You do the work, instructor comes back and double checks you, and then we take photos of everything to double check everything, and then we're studying all the cases in the class. And then how the class works is I have 10 operatories in my office, so I can accommodate up to 20 patients. Up to 20 dentists. Dentists work in teams of 2. Each team is assigned 6 or 7 patients, and so forth, and to see on Saturdays. And then, but we have typically about 50 patients in the class, roughly, maybe 60. And so as we're going, we take photos, records, everything, all the patients. So the whole class studies all those patients while we're going. Like, here's what went right, here's what went wrong, here's what the patient wanted, here's the diagnosis, Here's putting braces on. Here's stage 1, stage 2, stage 3 of ortho, and finishing, and so forth.
So, there's a follow-up. The doctor has a follow-up question here, and that is, are the patients in also different stages of treatment, or do they all start at the same time?
They all start at the same time. So the
Okay.
dentist is putting the braces on themselves, not just working patients in. They're putting the braces on, treating the patients, taking the braces off, fitting retainers, and so forth. And then we also sometimes I work in a couple of mixed. There's not that much to do in the mixed dentition case, but I get so we have 2 lectures on mixed dentition. So sometimes I'll work in a couple of mixed dentition cases also into the class. Just I think it's good for them to see and so forth.
All right. So we got a lot more questions coming in here. The next question right here is, okay, so is there, obviously you have this initial 20-month training program, but what if I need more support? Is there like an advanced course? Can I come in and shadow you? Is there other workshops and whatnot? This dog's getting ahead of themselves, but that's okay. It's good for us to know. So is there extra support there?
Oh, sure. One is nobody's left alone. And so, like example, the first couple of cases, we encourage you to start cases at your office after session 3, because you're going to learn more. But I help you treatment plan the cases, and I'll walk you through them too. I still have dentists that email me cases that I've taught 15 years ago. Wow. I mean, the first year or two, they have a lot of questions, but then after that, not so much. So if they have a problem with a case, it's easy. Take a picture of it or X-ray. It's simply a picture. Email it to me. I'm happy to help you with it. Also, we have a study club, and which meets quarterly, and we're doing that. Like I've been training some of my former students. I have about 300 former students, and so I'm training a lot of them in how to do self-ligating brackets over ligature brackets, over tie brackets like mini twins and so forth. But there's a
lot of support there. Once you go through the program, you guys have Dr. Jeff's support there, with cases, and also having this study group to also talk with other graduates as well.
And plus, I have a couple other dentists that help me with this. I go also to the dental schools, and so there's a lot of support out there. You're not just left alone.
Okay, well, that's good. That's good to hear there. Now, I'm curious for myself. Your practice right now, is it limited to ortho, or do you do other things as well?
Oh, well, I have what I call a small group practice in Austin. So it's me. I have 2 other general dentists. I mainly do orthodontics. Every once in a while, I'll do some kind of restorative, but not that much anymore. Then I also have 2 oral surgeons at the office and a periodontist. And so it's kind of nice because I always like a small group. I like working with other dentists. So it's kind of a nice small group practice thing. Yeah. And then if people want extra education too, as far as the ortho class goes, we have training for dental assistants if they need it. We have training for office management if they need it. A big thing too, which people don't take advantage of that much, is I have a big vendor list. So kind of like yourself, I've gone back to ortho vendors, and I said, look, if you want it, I don't get any money off of any vendors, but I said, if you want me to advertise for you or give your information to my students, I have a preferred vendor list, and you can go through and it saves you a lot of money. Like example, Ortho Arch is offering us 70% off ortho supplies. I'm working with Spark aligners right now. I have Invisalign discount too. Spark aligners is just from Armco. It's just a lot of my friends who are really good orthodontists have gone to those over Invisalign, but they only in the past have worked with orthodontic specialists. I'm one of the first general dentists they're actually working with to allow me to do their cases. So we might also teach those in the near future. But I want to do a bunch of cases first to make sure they're okay before I really make any recommendations on that.
So Dr. Jeff, do you mind just kind of walking through? It's a 20-month program. Can you just give us like an overview? So like session 1, like is it so is it every month? Like what's kind of covered? Like, can you just give us like a quick overview so that our listeners can kind of get an idea of what they're signing up for?
Okay. Since we only have 20 months, Now when I did, I used to do it over 2 years because when I light getting brackets, it took about 2 years to finish a case. With self-light getting brackets, we're knocking about 4 months off. And mechanics are easier, so it's a little easier for me to teach. And so I shifted it down to 20 months. So I always tell people it's a little backwards. Like if I was going to teach in a dental school, I would teach anatomy, etiology, how teeth move, and so forth, then braces. But with this course, what we do, we want to get the braces on, so we finish in 20 months. So the first thing we teach people is, okay, here's how to put braces on. The first session is here's how to put braces on, which is actually really easy. Here's how to start a case and so forth. And then session 2 and 3 and part of 4 are just diagnosis. Because when you do braces, you divide it up into stages: stage 1, stage 2, stage 3. And you have the goals of the different stages. Stage 1 is just a level and line teeth. That means you just correct overbites or underbites, and you straighten teeth as much as you can with typically a small nine-tie wire. Stage 2 is closing space in extraction case. If you have an extraction case, stage 3 is finishing. But so what we do is we teach them how to put braces on, how to start a case. We step back. We do diagnosis, and then after diagnosis is complete, then we teach them, okay, here's stage 2, and then we teach them stage 3, and then we teach them finishing, and then after that we have 2 lectures on mixed dentition, what I kind of call it preventative orthodontics, like how to do palatal expanders, how to do anterior cross bites in the mixed dentition, what to treat, when to take teeth out, when not to take teeth out, when to put space maintainers in, that kind of thing. Then we do 2 other lectures, one on, I call it cosmetic orthodontics. It's just because most people here are either general dentist, pediatric dentist, or prosthodontist to take my course. So we teach them, okay, here's how you do ortho to make your restorative better, like and so forth. Then we do another lecture on orthodontic cases. Like here's how orthodontic works. Here's how you diagnose it. Here's what they do, here's what works. Here's what doesn't work, and so forth.
Well, again, guys, I mean, that's a very comprehensive course. And, for those who are just now jumping on, Dr. Jeff has been doing this for years. How many dentists have you trained over your career of teaching orthodontics or GPs?
I think it's a little over 300, something like that.
300.
Yeah.
And you've been doing this for how many years now?
Well, I started as a clinical instructor in 2000. Then became I don't know if you call it the head instructor, but the main instructor in 2006. And then I lectured different locations and so forth.
So he's been at this for a while. And again, this is just an amazing opportunity to learn ortho, to bring ortho. And here's the thing, maybe you're not comfortable with doing everything, right? And that's okay. Dr. Jeff just said that, 80 to 90% of the cases you can probably handle, but you know what? Feel free to punt whatever cases you want. But if you're not even attempting the easy ones, right? Because there are some easy ones, right, Dr. Jeff? You just said that. If you're not even attempting the easy ones, I mean, how much, talk about, let's do this. We're not going to even make up any numbers or anything. You talk about your former students. Obviously, you check in with them, you support them. And I'm sure they tell you like how much extra production they brought into their practice. Talk about some of those, some of your former students, some of the numbers that they've been able to add to not only add to their practice, but also make the lives of their patients convenient. Because honestly, patients, a lot of times they don't want to leave. They want to stay in your practice.
Oh, yeah. And they want to stay in your practice. And kind of how I compete with orthodontic specialists, I just charge a little bit less and so forth. But I'll probably say that it's kind of interesting because if I get people from a rural area, and within 3 years of taking the class, they're not doing general dentistry anymore. They're mainly doing ortho.
Wow.
But I don't get that. I get many people from urban areas, and they just want to add another skill level and so forth. But let's look at it this way too. I mean, people want to take veneer courses. Veneer's less than 0.2% of the dental market. Implants are fine, but you're kind of limited to what you can do. It's a little risky. Now people want to get into airway stuff, which is fine. I used to do a airway lecture about, 10 plus years ago, but you're looking at less than 2% of the population you're helping. With ortho, I mean, the good thing about ortho is a lot of people need it, and it makes you think a little bit differently or want it. I don't say they have to have it, but they want it. And so I don't like to sell things. So people come in the office and they don't they don't say, "Hey Jeffrey, please do a root canal on me. I've always wanted one." They say things like, "Hey, can you straighten my teeth? A tooth is coming out of my nose." You know, that kind of thing, and they're happy about it. I'll probably say that I don't know. I surveyed a couple dentists. It kind of depends on their practice, uh, how much they get into it, and so forth. But some of them increase their production by I don't know, 80 to 100,000 the first year, because and it depends on practice. I mean, some people are
Yeah.
really intimidated by it, and they don't want to start it right away, or they don't have the practice base to support it. But I've had, the ones that really get into it and learn the process and so forth, and read the book and come to class, they do really well. And so it pays for itself pretty easily like that. I mean, just think about it. Your average case, I mean, the orthodontists in my area are about $6,000 a case. I'm about 4,500. The class is 2,900 roughly. And so you do a couple of cases a month, and your overhead for doing ortho clay or ortho case, brackets, wires, everything like that, it's about $300.
Yeah.
And plus with your discounts and so forth. And so your overhead is not, and this is chair time. And so, like in my office, 80% of the cases, I have 3 ortho assistants, and they could do about 80% of the cases themselves that walk in the door. They don't really need me anymore. They always tease me about that. They say, "You're too slow and you talk too much." About right.
I love that. I love that. And it's something that also that to keep in mind as well as guys, obviously that's another service that you can do in your practice. You can help your patients. Patients most of the time they don't want to leave the practice. They don't want to stay there. They're used to you. They want to be taken care of by you. But something to think about as well is also getting new patients, right? That maybe weren't even in your practice, and they come in and that patient brings in hygiene, brings in possible restorative as well.
I mean, so what's happened to me is I get so many patients that come in for like an ortho screening off of advertisement, off of mainly referrals from other patients and so forth. Then they come to my office and they say, "Well, this is a nice place." And then they don't just become ortho patients; they become lifelong patients,
I love that.
and
I love
for
that.
other things.
So, Doc, so let's talk about this. Let's go into what is the normal cost, right? Well, we're talking about, look, we're in the Nifty Thrifty group. We'll talk about the Nifty
Oh,
deal, but
sure.
let's just talk the normal cost. What is the normal investment to do your program? What is the normal price?
Okay. If you take my program, it's typically about 15 grand or so. What we're doing now, one of my friends who's an orthodontic specialist in San Antonio, he's like $2,800 a weekend to see. So for your Nifty 50 special, which I appreciate, we're doing, we increased it to $5,500 off if you sign up for the end of this month. That
All right.
one that helps me, because what always happens is you got to realize it's a hands-on course. So I'm trying to pair patients with dentists, and every year I have dentists that want to. I'll have like 10 dentists signed up for a class, and I have at the very last minute 10 more dentists want to sign up. And so I'm like, "Oh crap, I got to get all these patients processed." And so if I get people signed up early, that saves you money and helps me a headache and so forth,
Absolutely.
which is nice.
So again, the Nifty deal is $5,500 off here. And again, like Dr. Jeffrey's been doing this for a while. You don't even have to find your own patients. And again, that's something that's kind of refreshing. You don't have to find your own patients. The patients you already have the patients. You'll have the patients lined up for all the students.
Oh, the other thing too is we have payment plans. We just do ACH their accounts over 18 months if they want to pay it out. Not a problem. We give early deal discounts. But let's say your patients, keep them for yourself, because the patients are paying me to do this class.
Yeah.
So if you want to treat patients at your office, great. We'll work them up. You can treat them. You can charge them. And it's like you should, and so forth, because that's your patients. And then that way the class pays for itself very easily. So it's going to pay if you start a couple of cases at your office. It's going to pay for the class easily, and so forth. The other thing too you might think about is like when I started in dentistry, I was doing general dentistry. Well, as I started doing more and more ortho, I hired one general dentist, And then I turned over half my general dentistry to them. And then I hired another general dentist and so forth. And then it opened up, well, now I need a surgeon. Now I need another oral surgeon. Oh, I got a friend who's a periodontist who'd like to work in my office. And so it's another way of growing your office too, just because you're adding another skill to your patients. Or you're just adding another service from your office that people want and need. And so that's another good way of expanding your dental office. I've had a lot of dentists that took my class saying, man, Jeffrey, the problem is I'm doing all this ortho now. I don't have time to do my fillings and crowns. And I said, okay, fine. Hire an associate. And they go, you can do that? Yes, you can do that. So I help. So sometimes I've helped them find an associate dentist and how to work an associate dentist and so forth also.
Wow. Well, so, what's the best way? Obviously, there's a sweet deal. We're going to put it in the comment section, guys. So don't worry about that. But what's the best way? Someone they're like, okay, I'm sold. I want to sign up. What's the best way to sign up for the course?
Oh, okay. One, you can call our office. I have a ortho coordinator, Stacy. She's been doing ortho for 30 years. She knows assisting. She got tired of assisting, and then she became my ortho coordinator. You can call her at 737-242-7455, and she'll try to answer all your questions. You can personally email me at drg@advancedfamilydentist.com. That's my normal practice. What else? Oh, then we have a website, of course, like everybody else. And the information is on there too. It's just Orthodontic Teaching Institute.com, and all the information is on there. And I'm the website's okay, but I'm in the process of trying to do a little bit better job on it and getting you up to date, put more videos and more instructional things. I mean, in other words, I'm trying to get a lot of information out there so you can decide, you can look at it and decide, is this right for my practice or not?
Hey, and you know what? If you have some questions, the man himself just gave up his email there. Email Dr. Jeff here. He'll be happy to talk to you. And again, hey, if you ever wanted to come to Texas, I mean, there's some really nice areas in the Austin area where this course is going to be. So, Dr. Jeff, thank you so much for jumping on. I can't wait to hear some of the Nifty members that come to your course, get their feedback. But thank you so much for jumping on. And guys, thank you so much for tuning in. We'll see you guys next time.
Okay, appreciate it.